A month ago, I convened the emergency committee under the international health regulations to assess whether the multi-country monkeypox outbreak represented a public health emergency of international concern. At that meeting, while differing views were expressed, the committee resolved by consensus that the outbreak did not represent a public health emergency of international concern. At the time, 3,040 cases of monkeypox had been reported to WHO from 47 countries. Since then, the outbreak has continued to grow, and there are now more than 16,000 reported cases from 75 countries and territories and 5 deaths. Under the international health regulations, I'm required to consider 5 elements in deciding whether an outbreak constitutes a public health emergency of international concern. First, the information provided by countries, which in this case shows that this virus has spread rapidly to many countries that have not seen it before. Second, the 3 criteria for declaring a public health emergency of international concern under the international health regulations, which have been met. Third, the advice of the emergency committee, which has not reached a consensus. Fourth, scientific principles, evidence, and other relevant information, which are currently insufficient and leave us with many unknowns. And fifth, the risk to human health, international spread, and the potential for interference with international traffic. WHO's assessment is that the risk of monkeypox is moderate globally and in all regions, except in the European region, where we assess the risk is high. There is also a clear risk of further international spread, although the risk of interference with international traffic remains low for the moment. So in short, we have an outbreak that has spread around the world rapidly through new modes of transmission about which we understand too little and which meets the criteria in the international health regulations. For all of these reasons, I have decided that the global monkeypox outbreak represents a public health emergency of international concern. Accordingly, I have made a set of recommendations for 4 groups of countries. First, those that have not yet reported a case of monkeypox or have not reported a case for more than 21 days. Second, those with recently imported cases of monkeypox and that are experiencing human-to-human transmission. This includes recommendations to implement a coordinated response to stop transmission and protect vulnerable groups, to engage and protect affected communities, to intensify surveillance and public health measures, to strengthen clinical management and infection prevention and control in hospitals and clinics, to accelerate research into the use of vaccines, therapeutics, and other tools, and recommendations on international travel. The third group of countries is those with transmission of monkeypox between animals and humans. And the fourth is countries with manufacturing capacity for diagnostics, vaccines, and therapeutics.